702.
Health and Wellness.
25 minutes before 12 o'clock, time for our health and wellness feature. And I want to hear from people who have been using antibiotics, because we're talking about the dangers of the misuse of antibiotics. The World Health Organization has also raised some concerns about this, and many other leading health experts, because antibiotics are, you could argue, one of the greatest medical discoveries of our time. They've saved millions of lives and made it possible to treat serious infections and carry out surgeries safely. But the way we use them today is actually putting a lot of progress at risk. You've got overuse and misuse of antibiotics, whether it's people taking them when they don't need to or doctors prescribing them too often. But it's causing bacteria to become resistant, which means then infections that were once easily cured could soon become deadly again. It also means that routine medical procedures like, C-sections, cancer treatments, or hip replacements could carry life-threatening risks, right? Misusing these antibiotics doesn't just affect one person, because resistant bacteria can spread, making it harder and more expensive to treat illnesses across the whole community. So do you use antibiotics, and do you know if you're using them properly? And how often do you take them? Maybe you've got questions for my guest as well around the use of antibiotics. You can call on 011-883-0702. WhatsApp's on 072-702-1702. Andriette van Jaarsveld is a clinical pharmacy specialist at Mediclinic South Africa, who's going to guide us through this conversation. Andriette, thank you so much for your time. Good morning.
Good morning. Thank you for the opportunity to join you today.
Let's start maybe with understanding the basic terminologies here. Can you explain, just in simple terms, what antimicrobial resistance is?
So I think that's where one of our problems lies, is that we talk about antimicrobial resistance and then we don't understand what it means. Antimicrobial is just a collective term for antibacterial, which is an antibiotic, and then antiviral and antifungal drugs. So all of these, antibiotic will kill bacteria, antiviral drug will kill viruses, and the antifungal drug will kill funguses. So they each work on the specific pathogen, and they have a different mechanism on how they kill that specific organism. And that's why we talk about antibiotics for bacterials and antivirals for viruses. And you can't use the same thing for everything. So you need to use them very specifically for the specific disease that you have. So if we talk about antimicrobial resistance, it actually then means that the pathogens, whether it is a bacteria or a virus or a fungus, get the drug that you want to use to kill them don't work for them anymore. So they get so clever that they get ways to fight this drug so that the drug don't work anymore and don't kill them anymore. And then you get antimicrobial resistance. But the problem that we are facing today and that we want to talk about is antibiotic resistance. So that's where you want to treat a bacterial infection.
Why is that antibiotic resistance being called one of the greatest threats to global health?
Because if we don't have these antibiotics, you've actually said that earlier, then we don't have anything to treat these common infections with anymore. And if we look at the impact on it globally, if we can't treat these infections with the normal drugs, then it gets much more expensive. We need to use more expensive drugs. People stay longer in hospital. It gets almost impossible, or sometimes actually impossible, to treat these infections. So it results in people dying from infections that we were supposed to be able to treat. But because there are so much resistance, we then can't treat these patients. So people die due to this. The other thing is that if people are sick, they can't work. So it has a major influence on our global economy as well, because we have this burden of disease and people that can't work, and we have people that are deceased and they also can't work. So it has an effect on the economy as well as people that are actually dying.
How are, from your observation, antibiotics commonly misused by the public?
I think the most common way where we abuse them is when we use them when we have normal colds and flu. So if you have a viral respiratory infection, you get very sick. Flu will really make you sick, but it's a virus infection. COVID was also a virus infection. So it doesn't help that you take an antibiotic, which is an antibacterial drug for that. So we use tons and tons of antibiotics for viral infections. So the only thing that happens then is you expose your body to this antibiotic. That's not going to have any influence on your sickness. And unfortunately, the way antibiotics work, if you take them, you expose the bacteria in your body to that. You also expose the people next to you. And that's why antibiotic use is something that whatever you do is not only influencing you, it's influencing your family, your friends, and it has a global impact because all of the bacteria then gets resistance because we overuse it.
Okay. 011-883-0702. I'm taking your WhatsApps as well on 0727021702. Do you use antibiotics? How do you know you're using them properly? Are you concerned about how you're using them? Maybe you want to ask Andriette some questions. How often do you take them? I've got a message here on the WhatsApp line from Kat who says, Clement, I have a toddler who is 2 and going to crash. She is always having a cough and running nose. The GP almost always prescribes antibiotics. I'm so scared of giving them to her. Often like once every, and I do it like once every 2 months now. And Andriette, that leads me to the next question around the role of doctors and just healthcare professionals here. What role can they play in preventing overprescription?
So I first want to address the mom with the toddler. I'm also a mom. I know how difficult it is when your kids are sick. Now the thing is with crash-going children, they mostly get viral infections. And there are many viral infections around. So that will cause this runny nose. And the, don't know if what's the right terms to use on radio, but the phlegm will actually get green in the end. Even that is not a sign of a bacterial infection. So these viral infections are extremely contagious. So if the one have it in the crash, all of the kids will get it, and it will make them sick. But please then just ask your doctor if he is really, really convinced that this is a bacterial infection, and if it's not a viral infection for which you don't need antibiotics. Unfortunately, you will in most of the cases need to take your child out of the creche for a couple of days so that they don't spread it to the other kids. And I know this is extremely inconvenient for all parents because you need to work. So I have lots of sympathy with that. But for most viral infection, if a child have a runny nose, even cough, antibiotics is not an indication for a cough. These respiratory viral infections will irritate your airways, which is your lungs and your nose, for up to 6 weeks afterwards. And if a child just gets the slightest, whimp of cold air, that will trigger a cough. And even the postnasal drip will trigger a cough. And I know it's very difficult when your child is coughing and coughing and coughing to not want him to give him antibiotics. But coughing is not a need for antibiotics. You need to have a viral infection.
Here's a WhatsApp voice note that's come through.
Hi, Clement. I'm listening to your conversation around antibiotics. I, for one, understand, the difference between bacterial and, viral infections. So I don't take antibiotics as a norm. I'll let the doctor prescribe them. I just don't order them. I just don't get them when I get to the pharmacy. However, I think this conversation needs to be taken up with healthcare professionals, because obviously we can't, as an ordinary citizen, get these antibiotics without a prescription. And, the layman doesn't know the difference between a bacterial infection and a viral infection and so forth. So I really think that this conversation needs to be elevated to that level, and get healthcare professionals more educated around the uses of antibiotics. This is Asa in Olivedale.
Thank you so much, Asal, for that. Andriette, Any comments on that? I do want to ask also about what you think ordinary South Africans can do to protect themselves and to ensure they use antibiotics responsibly.
Wonderful. Yes, I would like Clement to comment on that. I agree that the conversation needs to be taken up with healthcare professionals. We have programs where we do our best to educate healthcare professionals, especially those that's working in the Mediclinic hospitals. However, what healthcare professionals, especially general practitioners, report back to us is that the pressure from the public is very, very severe on them, that a patient will tell them, I want an antibiotic. If you don't give it to me, I will go to the next doctor, or they think that it's not a good doctor, and that they feel that it is taking up so much time to explain to a patient why they don't want to give them an antibiotic. So they simply sometimes just fall under the stress of the patient to give them an antibiotic. So from our side, if we can just not ask our doctors for an antibiotic prescription, don't demand that prescription.
Yeah.
Tell your doctor that you know that there's viral infections which may not need an antibiotic, and ask them to have a look and only prescribe it if it's really a bacterial infection. Sometimes doctors will say, okay, I'm giving you a prescription, watch and wait. If you see your child or you don't improve, then get the antibiotic from the pharmacy. That's also a good option. Then you can see if you don't improve in 2 days or 3 days, then you take the antibiotic. So that's actually the way that we can go, is to just reassure our healthcare professionals, our doctors, that we don't want to demand the antibiotic. Give them the opportunity to really diagnose you correctly.
Let's go. Yeah, go ahead.
No, sorry. And then when they prescribe you the antibiotic, take it as they've prescribed. Don't leave some for the next time that you get sick, or share some between members of a family, or do something like that. Take it as they prescribe it when they prescribe it for you.
Okay. Here's some more WhatsApps that have come through.
Hi, Clement. So I've worked with bacteria in the lab for a substantial amount of time, and I can tell you that bacterial antibiotic resistance is such a big issue. And I think, just like your guest has said there, it stems from abuse and misuse of bacteria. And I think one of the biggest impacts as well of misuse and abuse of antibiotics when you're actually not sick with bacterial infection, or rather when you're sick with a viral infection, is that you also kill your beneficial bacteria that are in your gut, which are responsible for your immune response. So at the end of the day, not only are you creating more resistant bacteria, but you're also killing the ones in your body that are actually helping you to defend your body, because most of these antibiotics are not selective. When you drink them, when you take them, they don't select which ones are the bad ones, which ones are the good ones. They just kill everything.
Good morning, Clement and your guest. I was prescribed antibiotics after having pneumonia during my radiation treatment. Like post-radiation treatment, I developed pneumonia. Fortunately, I had never taken antibiotics before in my life. So within 5 days, the coughing stopped. It was a persistent coughing for 6 months, for 6 weeks, and shortness of breath. On the 5th day, I was much, much better. Thank you, Dima.
Thank you, Dima. I've got a question here, Andriette, from Fahana, who says, what is the safest way then to treat viral infections without the use of any drugs, right? Maybe you can share some everyday steps, like hand washing, or is it vaccinations that can help reduce the need for these antibiotics?
Absolutely. Just as you said, hand washing is the utmost and foremost most important thing that we can do to protect ourselves from infections. If we remember from COVID times, we washed our hands like crazy, and normal soap and water is good enough. You only need hand sanitizer if you don't have access to running water. But hand washing as often as you can. That's the most important thing. And then also, as you said, vaccinations. If you get your normal flu vaccinations, but also childhood vaccinations, that prevents you from getting sick in the first place. So then you don't need the antibiotics. So that's very, very important to prevent infections, is to wash your hands and get your vaccinations.
Okay. Andriette van Jaarsveld, thank you so much for speaking to us, clinical pharmacy specialist at Mediclinic South Africa.